Amos Magaji, the chairman, House Committee on Healthcare Services, is worried that for several years health sector allocations have remained below 10% of the national budget, warning that the funding gap continues to strain healthcare facilities across the country. He says this is below the 15% health budget benchmark stipulated under the Abuja Declaration, noting that there is no wealth, education, or prosperity without a healthy population. The lawmaker maintains that the committee will work with relevant stakeholders to improve health sector funding.
One thing I wanted to understand is that for some of us that are even in the health sector, Abuja Declaration was done in this country here. And then up to today, many countries have gone to move their budget up to over 15%. But for many years, the budget of health is still less than 10%. And our population is growing in millions. And we are dealing with a budget that is not growing in proportion with the population. So we need to understand that in budget.
The Minister of Health, Mohammed Pate, presents the ministry's budget of 228 billion naira before the committee.
The budgetary allocation for the sector, for the Ministry of Health headquarters, it's 186 billion for capital, multilateral and bilateral 25 billion, overhead 1.5 billion, just similar to what we had in 2025. But you recall 2025, half of it was mopped up, and personnel costs the same as we had last year as well. Total allocation was 228 billion. And the big picture is that because 2025 had not been released, touched, it has been rolled over to 2026.
As deliberations continue, stakeholders are hopeful that sustained engagement between the legislature and the executive will translate into increased health sector funding in line with the Abuja Declaration, ensuring improved healthcare delivery and better outcomes for Nigerians nationwide. From the National Assembly, Henrietta Momodu, EBS News.